Hi everyone, welcome to Inside Corporate Troy. I'm your host, Ara Topouzian. I'm the President and CEO of Troy Chamber of Commerce, and I'm here today with a very special guest, President of Beaumont Troy, and Nancy Susick. Nancy, thank you for agreeing to go through all this ordeal with me today, but you have been a very good friend of Troy Chamber for a long time. Beaumont has been a friend of the Chamber a long time. Can you talk a little bit about the hospital here, the campus here?
Sure, I'd be happy to do so.
Brief history about it, yeah.
Happy to do so. And first of all, Ara, thank you so much for inviting me to speak about Beaumont Hospital Troy. Anytime I have that opportunity to talk about our hospital or any of our employees, we have phenomenal physicians, nurses, employees, and also volunteers that support this community. And I'm so proud and honored to be able to talk about them. So just to tell you a little bit about Beaumont Troy, last year we celebrated our 40th anniversary. And that was really a fun event for us here at the hospital, but also into the community. And as I reflected back, it was really interesting that a lot of people had talked about way back 40 years ago, and I do remember 40 years ago, you know, why are you going to build a hospital way out in North Macomb County or North Oakland County, kind of on the border of Oakland, Macomb County in North Troy?
Sure.
And it's really because the area was more farmland at that point. And our leaders at that point at Beaumont decided, yes, we are going to build a hospital out there. And as you can see, over the last 40 years, this area of Troy has just flourished. The community's wonderful. We're just absolutely pleased that we had the opportunity over the years to really grow with this wonderful community out here in Troy. Currently at this point, we are 520 beds. And we have other ambulatory sites that actually roll up under our Troy division. We have so many comprehensive services that have developed over the years, from heart and vascular to oncology, orthopedics, and even women's and children's services have developed over the last 40 years. And I'm really proud of the more than 5,000 employees, 1,300 physicians, and over 800 volunteers that support our community and our hospital.
Talk about Project Search. This is a program you're quite proud of and something the hospital is engaged in.
Yes, I am extremely proud of Project Search. We have partnered with the Troy School District along with Michigan Rehabilitation Services and Community Mental Health. And what we do is we have, this is a program for students between the ages of 18 and 26 who have gone through school and may have cognitive or physical disabilities and need some assistance in getting into the work environment. So we bring them into the hospital just like a school year in September. We have a teacher from the Troy district that works with them during the morning hours and teaches them some life skills, employability skills, how to work in a hospital or even in a business environment. And then in the afternoon, they are interns and they go into various departments. They may work in our family medicine department or patient registration, up on our nursing patient care units, and they work alongside our staff. And at the end of the program, they graduate in June, and then we would like to try to employ as many of those students as possible. Over the last 6 years, we've employed 18, and we've kept all 18 here within our hospital.
They're still here.
They're still here. And those that we did not employ, we've worked with community partners, and we're always looking for more community partners for our students. And the Troy Chamber's been wonderful in helping us connect, and so has the City of Troy. Our mayor's helped to connect us with some businesses that have employed these students.
So I would imagine some of these kids may not have had any interest in having a career within, you know, the health field or hospital. So it's got to be pretty amazing really to talk to some of these kids and how they really get into it, and you're almost creating careers for them.
And we talk about them at kids. They're actually young adults. And they are.
Hey, they're all kids at this point, right?
But they're actually young adults, and they do a phenomenal job working with our team here. And they love their jobs, and they've stayed with the jobs. I've had some students that have been here the entire 6 years that we've had the program when they started in the first class. So from a retention perspective, that's been wonderful. And we've taught those students a lot, but those students have taught all of us as employees and people at Beaumont Troy on how to work with individuals that may be, have some disabilities.
That's great. Yeah.
And it's just been a wonderful program.
So let's switch over to the emergency room.
Sure.
You know, you have to talk about an ER if you're in a hospital,
Right.
and I suspect it's getting busier and busier.
It has.
Can you talk to that a little bit?
I sure can. Every year our volume at this hospital continues to grow, as I've talked about before, our community. Last year we saw over 102,000 emergency visits or patients coming through our emergency center. And back in about 2 years ago, we became a level 2 trauma center. And that's a designation that the American College of Surgeons designates hospitals for, to be able to take care of level 2 trauma type patients. And those could be patients that are coming in from auto accidents, could be slip and falls. Any of those major type of injuries would come here to our hospital. And we have done a tremendous job with caring for those patients. And it requires us to have 24/7 coverage of specific physician and staff specialties to make sure that we can care for those level of injuries.
So is that's going to just increase as the years go on? I mean, how do you prepare for the future of that, or why is it increasing so much?
Well, their community is growing.
Right.
People are choosing certainly to come to Beaumont.
Yep.
And what we're trying to do is really work in the community to hopefully prevent some of those injuries.
Yeah.
Within our trauma program, we are also then required to go out and do community education.
Okay.
So we do a lot of community education. We have a program called Matter of Balance, working with our senior adults so they do not slip, they do not fall, how to protect themselves.
Right.
We've also begun to work with some of the cities and police departments in our communities to help them and do some education and training alongside them, because many times when police and fire departments are called to homes, it's because of a fall to get a senior up. So at this particular time, we're really trying to do more education in the community to hopefully prevent some of that.
So let's talk about nursing here at Beaumont Troy, which is also a major strength for the hospital.
Yes. Our nursing organization here, we are designated as magnet status, which means is the highest acknowledgement for any nursing organization. It's a designation that is given by the American Nurses Credentialing Center and recognizes nursing for excellence. Through that program, we have to have and meet a high level of standards for nursing practice within our organization. And there's a lot of research that's out there that those organizations that are designated as magnet organizations have better patient outcomes. We have higher nursing retention rates, and our nurses really want to work here and continue to work here, and it's a way to attract nurses to come to our organization. And one large component, I think, of that is nurses here at our hospital really feel, and I certainly encourage, that they have a voice in our nursing practice. They help us in setting nursing practice for within our organization. In addition to any of the meetings that we have in our hospital for planning, if we're going to build a new program, build a new unit in the hospital, we have nurses that are in those roles that help us in that planning and preparation.
You know, when you said the patient outcome is so much better, I mean, when you really think about it, the nurse is spending more time with the patients than really the doctors are, and I think that that's pretty crucial.
Right. And a part of the magnet designation is not just for nursing alone, but it also recognizes the communication that we have with our physicians. So our physicians and every single department in the hospital is very important when we receive that designation, because we all work together to communicate to take care of our patients.
So speaking of nursing and nurses, you know where I'm going to lead into this. You have a very unique background, and I think our audience would love to know what your background is.
Sure. Well, I've been a nurse for about 32 years. I went to Mercy College of Detroit for my bachelor's, and then also I went on to my master's degree at Oakland University, and worked at the Beaumont Royal Oak for about 14 years. And then after that came to Troy, after some other leadership positions at Royal Oak, came to Troy in 2000, and then proceeded to some leadership positions there here at Troy, and then became president about 6 years ago. Alongside that, I also had a career in the Navy. I was in the Navy Reserve for 24 years, retired back about 6 years ago now also as a captain in the United States Navy Reserve. And I a lot of times get asked, well, how do the two careers kind of
Right.
complement each
Right.
other? And both were wonderful, and I think both have really played a success in both of my careers, military and civilian. And two of the things that I always talk about is leadership that
Yeah.
I learned in both,
Sure.
and also teamwork, particularly in the military, because when I was in the military and working in the field, and I did a lot of field training also, which a lot of people are kind of surprised that I was
Yeah.
doing some desert training. You have to really learn to work as a team.
Right.
And you have to be able to have your partner's back.
Yeah.
So even here in a hospital, it's the same type of thing. You have to really be able to work as a
Right.
team member.
Right. It actually makes sense to have both careers. It
does.
matches pretty well.
It really
for you.
has. And to me, veterans are really,
Yeah.
really special to me. And interestingly enough, here at the Troy Hospital, a lot of our patients that come to us, we still have a fair amount of World War II veterans here in the hospital. And what I've made it as a passion of mine, and certainly my staff and my nurses have all gotten on board, and even our hospital chaplain, that when I know there's veterans in the hospital, we visit the veterans,
Oh, great.
and we provide them a red, white, and blue blanket. And some of our
Very
veterans,
cool.
it's the first
Yeah.
time they've ever been thanked
That's
for their
amazing.
service. So it's one of the real things that I think is really unique and special for us here at Troy.
That is very cool. With that background and with
Uh-huh.
that career that you've had, and you talk about teamwork and leadership and
Mm-hmm.
so forth, it's very important for you to be a mentor,
Mm-hmm.
especially to women.
Right.
Talk about that. You were one of our past speakers when we did Top of Troy,
Yes.
and I always love that event. We probably don't do enough of those kinds of events, but it was really intriguing to me to hear kind of your life story and sort of how you operate, and a lot of what you talked about really was sort of that mentorship and
Right.
women in leadership.
Right.
Talk
Right.
a little bit about that.
Sure.
I think that's important.
Mentoring women and also men. I've done both over my 30-year career here.
Right.
But I think particularly with women, because I've had a very long, different, unique career, lots
Yeah.
of various different opportunities, and I'm just really passionate about women finding their own voice and what they really feel that they want to do in the future. I have many women that come to me and ask for me to help them with mentoring or coaching and so forth. And the first thing I say to them is, what do you want to do? What are
Right.
your values? And I really help them to maybe take some risks and also kind of unleash their passion. That's what I think is important, is to help them unleash their passion. Not for me to help them to do that, but for them to do that themselves.
Right.
And one of the things we've done at Beaumont, we created a Beaumont Women's Employee Resource Network. I did
Okay.
that along with some other women in the organization, and one really phenomenal young woman, Bernadette White, from our Royal Oak Hospital, who's a phenomenal leader. She and I brought a group of women together, and we had about 1,000 members within the organization, and it's still functioning. And we just meet on a regular basis, just for women to get together, to network, to talk with each other, to help support each other. We've had some programming, similar to what we
That's
had at
great.
the Top of Troy.
Right.
And I think that's really made a huge difference for the women in the organization. And as I mentioned earlier too, not only women, but even men. I have had a lot of men that I've worked with in our organization to really help promote them. And I think a lot of times many of the individuals that have worked on my leadership team have been promoted to other positions within the organization. And once again, it's looking for those opportunities for
Yeah.
people, whether it's a committee or whether it's a group, but just exposing them to others in the organization on
Right.
what some of the talents that they do
Right.
have.
That's phenomenal. That's fantastic.
Yeah.
You keep doing that.
Absolutely.
Talk about outreach. We all do outreach,
Yeah.
but I think when hospitals do outreach, it's very unique and very specific. Talk about some of the different community events that Beaumont Troy engages in.
Oh, absolutely. First of all, we've had a lot of community events here in this particular facility where we're at right today. We are in the Mosherry Learning Center, and the Mosherry Learning Center opened just about a little over a year ago now. And this was for a wonderful gift that Dominic and Frances Mosherry and their family provided for us at Beaumont Troy. It includes a learning center, a number of classrooms, simulation labs, and then Mr. and Mrs. Kazi also donated some funds for us to have the auditorium, which is 175 seats, which is certainly open to the community, so our people can certainly
it's
come and
beautiful.
utilize
It definitely is
our
beautiful.
community.
Yep.
But one of the goals that the Mosheris, and we sat down and talked with them, was to actually have a place where people could come and learn, not just our staff. It's certainly an important place for our staff to learn and go into a simulation lab, particularly for new nurses or even existing nurses, a place where they can go and learn and new procedures, new techniques before our patients, before they actually go and treat our patients. So that's been phenomenal. But for the community, we've had a number of events that we've held in our center here, from heart and vascular events to diabetes and to weight management. And these are things that we identified that were areas within our community when we did an assessment of the community that our community felt were important.
Right.
So that's why we provided those particular events. We also go out into the community. As I mentioned earlier, we do some injury prevention in the community. We've worked with the Troy schools. We have athletic trainers actually in about 7 schools within our community. Both Troy high schools are Beaumont athletic trainers, so we do a lot of education in the schools. We've worked with the Troy Chamber on a number of things. We have a speakers bureau. So we have Beaumont employees and physicians and volunteers out in our community all the time.
Right. And Troy Beaumont connected to the entire system. Maybe give a quick little overview of who's all involved, how many hospitals, and you've got pretty much the Tri-County area covered.
Yes, Beaumont Health is now 8 hospitals, and we have a large ambulatory network across Southeast Michigan. We're the largest health system within Michigan. And we really have come together, and we've learned so much from each other within our hospitals, and we really leverage each other on education and training and just really working together to provide excellent care for our population in Southeast Michigan.
And one of those is this patient and family-centered care.
Yes, we are all very excited, and I do think this is one particular area where it really has brought Beaumont Health and all of our hospitals and ambulatory sites together.
Right.
We have a goal that by 2022 that we are going to be the national leader for patient and family-centered care.
Great.
Lofty goal, but a very good goal, but we really do feel we are definitely going to get there. Our senior leadership has been very supportive, and what that really means is that Beaumont Health and our leaders and our patients and our employees and our family members and physicians and volunteers are all coming together as partners in care and working together so that we're working with our patients and our families as we're designing care and working and developing care and care plans for them. That's what's really important, to really have that patient and family involvement.
You know, as we wrap, we could talk for a long time about this, and what's unique, and I will say, you know, you have a community advisory council, which you have me part of, and which I thank you for that. But what I find very interesting about is really all of what you're doing. I mean, it's amazing. I mean, it's very smart to have this council too, to really be able to express all the work that's going on here, and you know, we then in turn disseminate that information out in the community. So, you know, I thank you for having me be part of that. But the question I always come to is, you know, what are the challenges? You know, either healthcare or maybe more specific here, Beaumont, Troy. What do you see in the future as your crystal ball of challenges that the hospital may be going through as we wrap up?
Yeah, I think there's always going to be challenges within our community, within our healthcare, whether it's nationally, locally. Looking at reimbursement changes are always going to be a challenge for us. But what our goal is at Beaumont is to really to operate as efficiently as possible, but providing the best quality and safety for our patients and families. And to really do that, we have to include our patients and families. And sometimes that can be more of a challenge than others, but our team is learning together to make sure that we're partnering with patients and families. We have a terrific physician staff. We have employees and nurses and volunteers, as I said. And any type of new program or anything that we're trying to develop here, we reach out into the community for patient and family advisors to sit on those groups and tell us. We know here, I believe at Troy, we're going to continue to grow, and to do that, then I need to reach out to our community and say, and to you as you participate in our Community Advisory Board, help us understand what are you hearing in the community that we need to make sure we consider. And at that perspective, then I know that we are definitely going to continue to be successful here at Beaumont Troy and take care of our patients and families, because they're our community, they're our friends, our neighbors, and our family.
Nancy, thank you for taking the time to talk to me today. I mean, it's always a pleasure coming here. Certainly we're in the Mosseri Learning Center today. It's a beautiful news center, and you're doing phenomenal work in the community, you and your staff, and I want to thank you for taking the time today.
Well, thank you very much. We're very honored to have you here today, and as I said earlier, I just love talking about Beaumont Hospital Troy and the wonderful facility and our employees, physicians, and volunteers we have. So thank you.
Thank you again. That's about all the time that we have left. Again, I'm Ara Topouzian with Troy Chamber of Commerce, Inside Corporate Troy. For more information on the Chamber, we'd ask you to go online to troychamber.com and hope to see you soon. Take care.